Hello everyone. So the month of October is celebrated as Breast Cancer Awareness Month, and on the occasion of a very special month, we have a special guest with us, Dr. Jenny Rudra, who is associated with a medical college in Maharashtra, and she is going to enlighten us on the topic of breast cancer, and she is also going to tell us about the steps required for self breast examination. So, Dr. Jenny, I welcome you on the behalf of Switch India.
I would like to thank Switch India for giving me this wonderful opportunity. So, I'll start with what is breast cancer. So, breast cancer is basically the abnormal proliferation of cells. That is, the cells in your breast don't get a stop signal. So, they keep on proliferating, which leads to mass or a lump in your breast. So, with this, we can start on what are the various types of breast cancer. So, breast cancer can be broadly divided into two, which is invasive and non invasive. Again, it can be further divided into lobular, and ductal carcinomas. For the non-invasive kind, they are the ones which are conformed to the state of your breast, whereas the invasive breast carcinomas can present in various ways. The ductal breast carcinoma can appear as a lump in your breast, whereas the lobular breast carcinoma may not present as a lump, but may present with underlying causes such as discharge from your nipple or change in the shape, size, or even the texture of your skin. The most common type of breast carcinoma is your ductal carcinoma, which accounts for over 50 to 70% of the cases, whereas the lobular carcinoma, which is a little hard to detect on breast self examination, accounts for only 10% of the cases.
Okay. So I would like to ask, is there any predominant age group in which breast cancer is more common?
Yes, there is a predominant age group. So that age group in Indian women is around 40 to 50 years, with most occurring from between 45 to 49 years. But there is a very worrying trend that Indian women tend to get breast cancer at a younger age compared to their counterparts. So this is one of the reasons why the survival rate of Indian patients is poor, because they have an earlier onset of disease, they have a late disease stage progression when they are presenting to us, and they have a delayed definitive management and inadequate management and treatment.
Okay. If for any disease for that matter, early detection is like a boon. If the disease is detected early, it can be treated early. So, is there any specific test to detect breast cancer early?
Yes, so there are multiple tests. So one of the main easy things to do is your breast self-examination, which is not accepted as an early detection method, but it can be used as an adjunct. Matlab, it can be used in addition to the test, which I will say later on. And this orients the woman to her original breast, to her own breast. So if anything goes wrong, she is vigilant about what is going wrong. The most effective is clinical breast examination by a primary healthcare worker every 2 years, which has led to a significant downstaging of the disease at diagnosis. Even you can also go for mammographies, which is basically X-rays of your breast. And but the issue is that Indian women tend to have denser breasts, so there is a lot of false positive. But this may lead to overdiagnosis. But I think overdiagnosis is not as bad as underdiagnosis. And you can also go for ultrasonography of your breast, and it is very helpful in younger women who have denser breasts.
Okay. And as we all know, for any disease, there are many rumors and myths associated with it. So, what are the myths you encounter during your practice about breast cancer?
So one of the most common is that men don't get breast cancer, which is not true. Men with family history of colorectal cancer and prostate cancer do need to get screened for breast cancer too. One more is that only unmarried women get breast cancer, which is also not true. Even though having children is a protective factor for breast cancer, but there is no evidence stating that unmarried women get more breast cancer. Another one very peculiar thing I've heard is that carrying cell phones causes breast cancer and wearing a bra causes a breast cancer, which there is no evidence to back up. So then another is large women with large breasts get breast cancer, but this may be due to the underlying obesity, which is most often related to it. And also because of the large breast, it may go undiagnosed for a long time, so which leads to a later stage at presentation. And again, when, as I've said before, many times breast cancer may not present with a lump. So many people say that I did not have a lump, so how can I have breast cancer? It is not true. There are many different types of cancer, and according to the type, it may or may not present as a lump.
Okay, so thank you so much for all this information. Moving forward to our next segment, which is the most important segment, I think, in the today's session, and that is self-breast examination. So, will you please enlighten us on the steps of self-breast examination?
So, since I don't have a model with me, I would like to use an orange. So it is a very
Okay, that works.
orange is a very common thing which a doctor will use to describe your breast. They may say that was the lump the size of a lemon before, or was it a grape before and then it became an orange. So I'll be using an orange to demonstrate it. So first you have to examine yourself with your breast, especially with the in a mirror with the hands on your hips. Begin with looking straight into the mirror with your shoulders straight and your arms on your hips. You have to look out for breasts that are the usual size, shape, and color, breasts that are evenly shaped without any visible distortion or swelling. If you see any of the following changes, like dimpling, puckering, or bulging of the skin, or a nipple that is inverted position, redness, soreness, rash, swelling, you have to report to a doctor. Next, the way you have examined yourself with your hands on your hips, you have to raise your arm and examine, because sometimes redness, dimpling may not occur when you have your arms on your hips. When you raise your arms, the redness and dimpling becomes more prominent. Next, you have to look for fluid. So it may be the fluid that is coming out of your nipple. So it could be watery, milky, yellow. And especially if you're not lactating, you have to always be vigilant about it and report to a doctor if you see any fluid. You can next you have to feel for a breast lump by lying down. So once you lie down, you can use your left hand for your right breast and your right hand for your left breast. You have to use the finger pads of your three fingers. Keep your fingers together and use firm, but and go in a circular manner, which is in the shape of a coin. So you have to palpate in a very small circle in the shape of a coin, using a firm and smooth pressure. Now, once you have moving in small circles, you can go two ways. You can either move in like circles which are going progressively larger, or you can go up and down vertically like you are mowing a lawn. Always remember that you have to cover your entire breast tissue. Your breast tissue is not just the part that you consider as your breast. Your breast tissue extends from your collarbone to your abdomen, from your sternum to your armpit. So you have to complete that entire area. So you can either move out from your nipple in a circular manner, or you can go up and down from your collarbone to your abdomen. You have to use a firm pressure for the skin and the underlying tissue, and hard pressure up to your rib cage for the deeper tissues. You should always be able to feel your rib cage, and any lump you should, if you see, you should always report to a doctor. Again, once you're done this lying down, you should repeat this when you're standing up. This may be difficult if your skin is not slippery. So we recommend that you do this after taking a shower or a bath. Also, you may ask, like, when should we do a breast self-examination? So if you're menstruating, you should probably do it a few days after your period, because that is when your breasts are not swollen or tender. Also, if you don't get your periods anymore, you can always have a date of the month you should do it on. So either the first of the month or the last of the month. You can maintain a diary where you can assess and note down the neighborhoods. So each breast also has neighborhoods on its own area. So like the upper outer quadrant will have the most lumps. The part below your nipple may feel like sand. The part below the lower part of breast may also feel like sand. So every breast differs. So once you do it monthly, you can keep a record of this in your journal, and you can accordingly report to your doctor if you feel any changes. And also, it is not very uncommon. So when lumps present, when it's not, especially like if you're on your period, some lumps may present which may go away after your period ends. So you should always keep a lookout for that too.
Okay. So there was a lot of information for our viewers, and all the tips, I think they are really very helpful for self-breast exam, as well as the early detection and the myths associated, to burst all those myths and to gain knowledge about the detection process. So thank you so much for your valuable time and for contributing to a cause. Thank you, Dr. Jenny.
Thank you so much, Fit India, for having me.